Assalamualaikum and good morning. My name is Hannani, binti Rizalman, and today I will be sharing with you my more informative speech. Before we start, have you ever wondered taking care of your oral health can positively affect your general health? I have a story to share with you. Alisa is a student. She had not seen a dentist for years because there was no reason to. She had no pain before this. So, she went to a dental clinic and told the dentist that it was difficult for her to chew the food. After the dentist did some examinations, Alisa had an abscess on her wisdom tooth. The dentist gave her some antibiotics. 1 week later, the abscess went away, but she didn't return because she thought she was fine. But then, she came back again and the abscess came back. Alisa had a dental infection. A few days later, the dentist removed the hopeless tooth because it couldn't be saved anymore. She came back 1 week later for a review and she said she can eat peacefully without any difficulties to eat. She is happy. The reason why I chose this topic because I was a dental surgery assistant since January 2019. I have seen hundreds of patients with multiple oral hygiene problems, and maybe I think that is something good to share with. Also, I did additional research for this speech. And let's move on. What is oral hygiene exactly? Oral hygiene is important to our oral health because it reduces the risk of developing tooth decay and gum disease. These oral health problems are caused by excess bacteria either on the tooth enamel or around the gums. According to the National Oral Health Survey of Adults 2010, 88.9% of adults in Malaysia had tooth caries and 94% had gum disease. The main cause of gum disease is plaque, which is a soft sticky film containing billions of bacteria. And today, I would like to inform you about oral hygienes are important to oral health and general health. First, let's begin with oral hygiene plays a crucial role in oral health. For your information, oral health can affect your physical and emotional well-being as it can impact appearance, interpersonal relations, diet, nutrition, and speech. Having a clean and healthy mouth gives you a brighter smile and can boost your confidence. Healthy teeth can help us to chew and digest food. We can talk and speak clearly and it can prevent from bad breath. Moreover, good dental hygiene can prevent from tooth loss. Losing a tooth can cause surrounding the teeth to shift and bacteria to accumulate under the gum line, resulting in further gum disease and loss of bone and tissue. However, there are many ways to maintain good oral hygiene. The first one is brush your teeth at least twice a day for 2 minutes each time. Second, use a soft bristle brush and fluoride toothpaste. Third, do not rinse your mouth after brushing. Fourth, do not eat or drink for 30 minutes. Other than that, visit the dentist regularly for cleanings and exams. This is one of the most effective ways to detect the early signs of gum disease. The last one, which is I think not everyone can do it, that is, you should use floss every day to prevent from food stuck between your teeth. And let's recap what we have spoken about today. Remember the story of Alisa I mentioned in the introduction of my speech? I hope the information I have provided today will help you avoid the same situation like Alisa. By understanding the importance of oral hygiene and by following the simple preventive that I have discussed, you can make sure that you can practice oral hygiene for your own benefit. To sum up, oral hygiene plays an important role not only in preserving our oral health but in preserving overall health as well. That is why it is important to have a regular checkup with a dentist every 6 months. Taking care of our oral hygiene is an investment in our general health. That's all from me. Thank you.
Let's jump into my main point 1. The cause of internet addiction is underlying mental health conditions. It is because of strong correlation between internet addiction and psychological disorders. There is a strong correlation between internet addiction and a variety of psychological disorders, including anxiety, depression, low self-esteem, and bipolar disorder. According to a systematic review of clinical research on internet addiction and problematic internet use from the World Journal of Psychiatry, studies indicate that multiple chronic conditions appear to be common for people who suffer from internet addiction, particularly depression and anxiety disorders. Furthermore, students depend to the internet to find relief from the symptoms. People who suffer from anxiety or depression are more likely to turn to the internet to find relief from symptoms. Similarly, shy people or those who suffer from social awkwardness are at an increased risk of having an addiction to the internet. As reported by Richard Davis from the Psychology Department of York University, in his article published in Computers in the Human Behavior Journal, dependence on the communicative features of the internet is commonly linked to a lack of real-life social support and feelings of social isolation or loneliness, which all contribute to the development of internet addiction. In conclusion, the cause of internet addiction among students is underlying mental health conditions. Living with technologies can bring so many impacts in our lives, positively and negatively. We, as the university students, should think carefully and control ourselves from using too much internet in our daily basis, because we are the future generations that need to lead the world. So, please minimize the things that could harm ourselves for the sake of our future.